Hello everyone, this is Harikrishna Kadiyala. So many people are experiencing nose allergy, allergic rhinitis. Different people like adults, children, and also you have so many doubts that what type of tests we have to perform for nose allergy, what type of causes are there, what type of treatments are there. So I know that you have so many doubts. Today we have Dr. Ramarao sir, homeopathy doctor from Fidicus Homeopathy. Let me ask whatever the doubts you have from me so that you will get a complete understanding of nose allergy. Hi sir.
Hi.
Why do some people wake up and they feel that a burst of 15 to 20 seizures continuously? Is it really a reason due to weather conditions? Are there any hidden reasons?
So in our body there is a immune system which acts if any foreign body or if any foreign material comes in contact with our body, the immune system reacts in an instant. So in people with nose allergy or in conditions like this allergy conditions, when any small particle like it can be small dirt or anything, if it enters our immune system, so our immune system will be very sensitive and it acts as a security guard and it will trigger some responses which are like sneezing and then allergy and continuous nasal discharge from the nose and also continuous discharge from the eyes, watery eyes and cough. Sometimes patient may also experience cough in this condition. So when the immune system triggers because of these factors such as dirt or anything, any conditions, any foreign material like it may be pollen or fur or any dirt, it may trigger this. There are millions of nerve fibers inside the nose. Because of the sensitive nerve fibers, the reaction it will be triggering a immune reaction. Because of that, people will be experiencing these sneezes continuously. It can be due to many reasons like weather change also can affect. And also like pollen and also like fur. Because of these conditions, people experience continuous trigger and sneezing in the nose allergy.
Okay. Sir, when nose completely blocked, some people uses tissues or handkerchief, something like that, but nothing will comes out. It is continuously happen in often. Why this is happen? Is there any reason behind it?
So in our nose, when we continuously sneeze or when we wake up early morning, our nose will be completely blocked because of nose allergy in some people.
Okay.
So because of this completely blockage of this, there is collection of thick mucus. What we call it as some discharge from the nose or mouth. If any expectoration or anything comes out from the nose, what we call as mucus.
Okay.
Mucus, it will be the cause of the blockage.
Okay.
Because of this blockage, many people, they blow into tissues and nothing comes out.
Okay.
Internally, our nose structure, it has like three curved structures.
Okay.
Those three curved structures are like the air conditioning units of our nose.
Okay.
When the air conditioning units of our nose damages, it will be very difficult for us to sneeze.
Okay.
So the nose will be blocked. It's because our bony structures can't expand, or only the structures what I have told about the three curved structures. Those are called as turbinates. Those three curved structures like turbinates, they expand like balloons.
Okay.
Because of those expansion, our nose gets blocked easily very often.
Okay.
In many of these people, the nose allergy is compulsorily present.
Sir, and if you observe some people, they are affected with nose allergy. They used to do with their hand. They continuously, repeatedly moving their nose upward with their hand or fingers. It become a habit to them. Is it a habit, or is there any reason behind it? Is there any problem with that?
So, firstly, because of the nose allergy, they want some quick relief.
Okay.
Because of this quick relief, they just rub their nose with the fingers.
Okay.
So like this, they rub continuously. It creates a thin line in between the mouth and the nose. Because of this friction, there will be a line created. That is called as allergic salute.
Okay.
And it may cause pain also in some people. In common cold, you can see there will be red thickening of the skin because of the constant rubbing with the kerchief or tissue or anything. But in nose allergy, because they have been experiencing this since many years, it creates a thin line, that is transverse line, that is called as allergic salute. Because of this, patients may suffer from many years. You can easily observe this patient has nose allergy with that line.
Sir, and one more thing, if any people suffering with nose allergy, if they attacked by nose allergy, usually they are saying that it is due to environmental problems, pollution problem, air pollution, or any other dust allergies. They usually blame the surrounding environment, but is there any main reason behind it?
So of course, dust and soil and pollen and air pollution, they are to be blamed.
Okay.
But if you see inside your home, there is a main hidden cause inside your home itself, inside your bed itself.
Okay.
You should be understanding that the main cause is inside your bed. There are many millions of insects, that is microscopic insects, called as house dust mites.
Okay.
These house dust mites are many million of them are on your bed.
Okay.
So because of these house dust mites, you may get experience these allergies. What house dust mites do is they eat your dead skin cells, flakes, and all everything whatever is shed on their bed. But the actual problem is not, you are not allergic to the house dust mites. You are actually allergic to the protein they shed. What is the fecal matter they shed? Because of that fecal pellets, there are fecal matter. They excrete on fecal matter. Because of that fecal matter only, you are experiencing this allergy.
Okay.
So this house dust mite is a 8-legged insect which is belonging to a spider family. On the bed there are many millions of them. They eat your dead skin cells. They eat whatever is on the bed.
Okay.
So what you should do is you should wake up every day and clean your bed in a neat way. For at least 3 to 4 days you should wash your bed sheet. On your bed sheet itself the allergy is hiding.
So you are saying that the problem and solution are in the house only.
Yes, in the house itself.
Okay.
You shouldn't be blaming any environment.
Okay. Okay. Sir, if you see some people, if you observe some people, especially some childs, if they attacked with nose allergy, they shift to do mouth breathing. Like they are taking breathing from mouth. They continuously do this. Is this chronic mouth breathing could affect the lungs?
Yes, mouth breathing is very dangerous because your mouth is not designed to filter the air.
Okay.
Your nose is designed to filter air. Your nose has many hair-like structures present that will be trapping any dust particles which comes in contact with your nose.
Okay.
But mouth doesn't have that function.
Yes.
Mouth is just designed to eat, digest whatever you are doing.
Okay.
But nose is what designed to be breathing. Nose is designed to filter the air and it will be keeping your nose moist.
Yes.
And it also helps in prevention of any of the dust particles. If any dust particles enters your nose, the cilia, whatever the hair particles are present, that will be trapping.
Okay.
That hair particles will trap the dust, any pollen or anything which is entering into your nose. Okay. Because of this, many people experience mouth breathing. Okay. Mouth breathing is very dangerous. When the nose blockage occurs inside the nose, and because they can't take air, because they can't breathe air through nose, their mouth will be opening automatically. This is a reflex mechanism. Okay. So because of this, mouth breathing will be happening. Mouth breathing is very dangerous to any children, adults or any teenagers also. Okay. When you breathe through your mouth, the raw, dry, cold air with invisible dust, it will be affecting your fragile lungs. Okay. So your lungs are very fragile, they are very sensitive. Because of this mouth breathing, you will be experiencing this kind of invisible dust or anything. Because of this invisible dust and also the dry cold air, you will be experiencing symptoms like coughing fits. Okay. You will continuously cough. You will continuously cough in the midnight. When you are mouth breathing itself, your cough will be continuously like this. Continuous 15 to 16 episodes of cough will be happening in between 1 hour itself. Okay. So because of this chronic mouth breathing, the fragile lungs which are very delicate, those will be affected. So it is obviously dangerous to experience chronic mouth breathing.
And one more thing, sir, if you observe some people, we will see commonly it is, if they affected with nose allergy, they will take some medicine from RMP doctor or any medical store and they neglect. Is it leads to severe conditions like asthma?
Yes, it may lead to asthma as well. We often say as one airway, one disease. Okay. Your nose and your lungs are not different parts. Your nose and lungs are continuously connected to one thing itself. Okay. So one airflow is present in between the nose and the lungs. When nose is affected, lungs are also affected. Just think of this as an example. If you are sitting in your front porch of your house, if the nose is present in front of your house and the lungs are inside the hall itself, but when if any small thing triggers, like any dust or anything, if this triggers, first your nose will experience, and then after that lungs will also experience, because continuous airway, one airway, one disease. It is a continuous airway itself. So when the nose is affected, your lungs will also be getting affected. So you should be understanding that the nose and the lungs are not different parts. They are both connected to the one home alarm system. So when the nose gets affected in the front, lungs will also be getting affected inside the hall. So because of this nose and coordination with the nose and the lungs, the brain will signal itself. When the nose is getting affected, it will be inflamed. Then the brain coordinates. The nerve fibers will be notified, and then the brain coordinates like there is allergy in the inside the nose. So we should release any chemicals that will trigger inflammation. So because of this inflammation also, if you neglect continuously, it may lead to asthma itself. As we have discussed, the nose and the lungs are in the one airway. When the nose is affected, the lungs will also be affected. Because of this lungs affecting, after chronic, like many years, continuous like 10, 15, 20 years, it may lead to asthma and chest tightness. You may feel tightness inside the chest and continuous sneezing itself. As we have discussed, continuous sneezing fits 10 to 15 times, early morning waking up. When you wake up early morning, after you get down from the bed, you'll be getting affected with this sneezing fits.
If any person is affected by nose allergy, that nose allergy effect is more in night hours compared to day, and especially if they lie down or if they went to sleep. For example, if they stand, it will give some little bit relief, but if they lay down, they feel breathing problem and nose problem. Why this is happened during nights?
So when you are standing up, the excessive fluid whatever is present, it will be draining down naturally from the nose. So that is called as nasal drip. That continuous excessive fluid from the nose is called as nasal drip. When you are standing up, that is the only advantage. And then when you go to sleep at night, the excessive fluid will go inside your throat. So it will be going into draining into the vocal cords. Because of this draining into the vocal cords, you will be experiencing continuous coughing fits at night. Because of this coughing fits, you will be waking up at midnight from 2 a.m. to 5 p.m. Many patients experience early morning 4 a.m. coughing fits, and after 1 a.m. because of this post nasal drip that will be inside the nose, inside vocal cords. The vocal cords will be getting affected, and because of this vocal cords affection, there will be continuous coughing fits at between 2 a.m. to 5 a.m.
Sir, if any person affected by this nose allergy and comes to you, what type of tests and investigations you suggest to them?
First test is when you come inside the clinic, the doctor just examines your nose first. They'll be shining a light inside your nose, and they'll be looking for any mass or any swelling. Because in nose allergy people, the mass inside the nose is swollen. You can see how they are experiencing. So doctor will confirm if it is a nose allergy or if it is any polyps. They also call it as a polyps, which is a mass, round mass which is present. First examination is very important. Then investigations are like, first thing, basic investigation which is very cost effective is complete blood picture. In complete blood picture you can see eosinophil count. That eosinophil count is very much important. If the eosinophil count is more, we can understand that allergy is present in this patient. So to find out exactly about nose allergy, there are many tests. First thing is IgE test also. IgE test, it is after complete blood picture, it is IgE test. In IgE also there are two types of tests. IgE specific test is present and IgE normal test is present. If IgE is more than normal, we can understand that this patient is allergic. Then IgE specific test is if you are specifically allergic to anything. Like that we can also understand if the patient is allergic to anything. After CBP and IgE also, you can also take X-ray or CT scan. In X-ray or CT scan, if you are experiencing this nose allergy or blocked nose since months, and if you are experiencing any pain around your cheeks or around your head or around your face, then you can do this test. If you can understand that there are sinuses which are empty spaces present inside the face, if they are getting affected or not. If the nose allergy is leading to sinusitis, so we can understand with this X-ray or CT scan, we can clearly understand.
Sir, one more thing you mentioned in between nasal polyps. So is this nose allergy cause nasal polyps?
Yes, it may also lead to nasal polyps.
Okay.
So these nasal polyps are a mass growing inside your nose.
Okay.
In children, from children, adult, teenagers also, nasal polyps may be present. Nasal polyps can also be hereditary. These nasal polyps are like hard masses which are present. They can be growing from small size to big size. If you are ignoring nose allergy from many years, they may lead to nasal polyps also. If they are very big, they may obstruct breathing.
Okay.
Because of this obstructed breathing, patient may experience loss of concentration, and then sleeplessness will be there, and they can't even wake up early morning. They can't even go to their regular activities. So these nasal polyps are very much dangerous.
Sir, some people confused with nose allergy and regular cold. What is the main difference between these two?
If you are experiencing cold will be only for a 7 days period.
Okay.
But in nose allergy, it will be more than 7 days. It will be more than 7 days, 15 days.
Okay.
If you are experiencing more cold more than 1 to 2 months, it won't be cold at all. It is a nose allergy.
Okay.
Cold is self-sufficient. So after the 7 days, you won't experience any of the symptoms, and cold will be having coughing fits.
Okay.
But nose allergy, coughing fits are very rare.
Okay.
In only night itself, continuous coughing will be there. But in cold, during the day also, this cough will be present.
Okay.
So nose allergy and cold are very much different. If you are having chronic cold-like symptoms, it may be nose allergy itself. If you are experiencing continuous nasal drip, which is nasal discharge from the nose, and also reddish color of nose, and discharge from the eyes itself, and irritation in the eyes, and irritation inside the nose, itching inside the nose, and also if you are experiencing any allergic symptoms, it may be nose allergy, it may not be cold. In every nose allergy, there will be allergen present. Allergen is nothing but any pollen, fur, dust mite, or dust, or smoke. Because of these many factors, you may be experiencing nose allergy. So this is the difference between cold and nose.
Mostly people use nose sprays. They give instant relief. Is there any problems due to continuously using these nose sprays?
Yeah, there are many problems by using these nasal sprays.
Okay.
These nasal sprays are very dangerous. When you use these nasal sprays for 5 days,
okay,
the nose will become very dry. Your nose actually needs fresh blood.
Okay.
So your tissues, your nasal tissues actually needs fresh blood. So when the fresh blood is not being released, your nose becomes very dry.
Okay.
So you may need again and again you may need nasal spray. That is called as dependency.
Okay.
You'll be dependent on this nasal sprays for instant relief. Because of this nasal sprays, there is very much danger to nose itself. Okay. You may not experience any smelling. You won't understand how you are breathing. Your nose constantly needs oxygen. Okay. So you should be breathing in and out. So because of this, you will be going to pharmacy and any medical store, or you will get your nose spray easily for instant relief. Okay. So that is very dangerous. Everyone should understand that nasal sprays are only for temporary instant relief.
Sir, and one more important thing, people they follow home remedies like they are using warm water. They put some jandu balm and they put some turmeric. They follow these type of home remedies. Is it good or bad for nose allergy patients?
For nose allergy patients, it is actually not good.
Okay.
If you are inhaling the steam, that should only be plain water, plain boiled water.
Okay.
Because of these mint drops or any jandu balm or any Vicks or any vapor, because of these vapors, you may experience different kinds of symptoms. You will be experiencing itching, sneezing, and continuous cough fits will be present. The steam itself is normal, but steam with these mint drops, any kind of mint drops is very much dangerous. As for turmeric, it has no evidence that turmeric may help. Okay. But plain boiled water is very much enough for nose allergy patients. Okay. If you want instant relief, this plain boiled water steam inhalation is okay.
Sir, coming to the main part, treatment. People mostly in middle class, if they affect with nose allergy, if they are with their children, usually they go to RMP hospital or they went to medical shops. They take some cetirizine tablets for instant relief of that continuous burst of sneezing and cold. They use this type of medicines treatment. Is it good or bad? Or if it is bad, what is the advantage of using homeopathy medicine for nose allergy? What is your view on these two treatments?
Firstly, after you use any anti-allergens, you'll be getting very much sleep.
Okay.
So sleep is the main important factor.
Yeah.
When patients of the nose allergy they come to us, they'll be saying only one symptom. First thing before nose allergy, I'm getting very much sleepy, sir, because of this tablet.
Tablets, medicine.
So the sleeping, it will be affecting very much. It may lead to again lack of concentration, sleeplessness, and daily productivity of your actions. If you are a software employee or if you are a teacher, if you can't stand for 5 to 10 minutes in front of the board, then it is very much bad in your day-to-day life activities. It is very much bad. You're not being productive in your life, or you are unable to concentrate on your family also.
Yeah.
Now coming to homeopathy, firstly we have constitutional treatment.
Yeah.
We'll be understanding about the patient itself, the individual itself. So if one person to one person there will be different treatment. The medicines will change and the type of case taking will also change.
Okay.
If you have nose allergy, we'll be asking about the family history. If your paternal side, like mother side or father side, if your mother experienced this nose allergy, or if your father experienced this nose allergy, or any of your siblings are experiencing this nose allergy right now, we'll be asking about their family history and past history, and also different types of history. We will be asking about the physical generals, how the patient is in day-to-day life activity. We'll be asking about their day-to-day life also. Everything will be considered, and we'll be giving constitutional treatment for each individual who is present. One person from one person, treatment will be different. Individualized treatment will be there, and it is a holistic treatment.
Okay.
So firstly, if any of the person is experiencing nose allergy, we can prevent nose allergy.
Okay.
If it is acute or chronic also, we can prevent the nose allergy.
Okay.
If he has chronic cold from 3 months, it may not be cold itself.
Okay.
It may be nose allergy. Before that, you can consult us and we can do the prevention treatment. And if you are experiencing nose allergy right now, we can also have cure. We can cure the patient also. And if you are experiencing nose allergy since only 15 days or 30 days, we can also give relief also. And with safe and effective treatment is present with us. You can contact me through Fidicus Homeopathy. I am Dr. Banda Vijay Ramarao. So we can give best possible treatment for your condition, nose allergy. We will be asking different kinds of questions, and we can give treatment.
While explaining this, you said that it is coming from parents, genes. Is it really happen in nose allergy condition?
So in nose allergy, if you are experiencing nose allergy, it may also come from father or mother side, paternal or maternal side.
Okay.
If your mother, grandmother, grandfather has these symptoms, or your father side grandmother or grandfather has these symptoms, this nose allergy can also be hereditary.
Okay.
From birth itself, you may be having this nose allergy condition. Okay. So because of your grandmother, grandfather, or your grandfather, okay, like that, you can be experiencing nose allergy from hereditary also.
Okay. Thank you, sir. So this is the guys complete details about nose allergy. I hope that you people are understand, and also you people have complete details whatever the doubts you have. If you have any more doubts about this nose allergy, please contact the number which is scrolling on the screen. Contact Ramarao sir. He will advise you the best possible solution for your nose allergy condition. Thank you.